The doctor is in the house here at South Texas Brain and Spine Center. Today I have the pleasure of sitting down with Dr. Alexander, and our topic today is brain tumors. Either you yourself or somebody that you know and love may have been diagnosed with a brain tumor, but there's more to it, and here are some of the basics. So it's great to be here with you today.
Oh, thank you.
Talk to me a little bit about a brain tumor. It's a very scary term. We know where our minds go first when we hear that. What do we need to know about a brain tumor?
So brain tumors can be both aggressive, like malignant, versus more benign. First off, you want to not, everyone thinks they have a headache, they got a brain tumor. So if you have symptoms that are concerning, so if you have any type of neurological deficits, weakness, numbness in your extremities, facial weakness, it could be a stroke, it could be a brain tumor.
Okay.
So if the brain actually has no sensation, you can actually cut the brain. I do patients wide awake doing Parkinson's surgery, and they're talking and there's no sensation to the brain.
So interesting. Okay.
And so it's kind of, so sometimes you can cause headaches, sometimes it doesn't have to cause headaches. I have patients who come in with a tumor. It's very slow growing. So meningiomas are one of the most benign type of brain tumors, and they only grow a couple of millimeters per year in most people. Some people they grow more rapidly, and some people they grow more slowly. So I've taken this out a size of a gumball to the size of an orange.
Wow. That is so interesting that something like that can exist and take up so much space when it seems like your brain's pretty much taken up all the inventory there, and that you could exist with this without even realizing it, and pretty mild symptoms?
Some people, yeah. Some people can present with really bad symptoms. So it kind of depends. Like the brain's actually a sponge. So when you have compression, until it reaches a critical point, then it causes symptoms.
Okay, other than that, it kind of moves out of the way and lets everything do its thing until then. So in the event that we're realizing that we have some of these symptoms, what is the first step? Do we just go see our family doctor, or do you think this is something that we should jump directly to you all for?
Typically, I would see your primary care doctor to talk about the concerns. Typically, to diagnose a brain tumor, you should get either a CT or MRI. And MRI is a lot more sensitive, so depending on where your symptoms are, they'll order one with and without contrast. Contrast will enhance where the tumor is, and it will let other causes like a stroke or MS or anything that could be unusual that can cause similar symptoms.
Very interesting. So the word that we're looking for relief when it comes to a brain tumor is whether it's malignant or benign, right? But even the event that it is non-cancerous, what are some other outcomes that can happen if it's not treated?
So it depends. Sometimes if there's really small and we think it's benign, then we would actually monitor it with MRIs every 3 to 6 months. The more aggressive ones, like Kennedy, had a GBM, glioblastoma multiforme, which is a very aggressive high-grade glioma, and it invades the brain. It has a high chance of recurrence. So those require radiation and chemotherapy. So typically we team up with an oncology team, and we do the surgery, and then they will treat them for any of their other things they need, like radiation or chemotherapy.
Good to know. So for anybody looking for more information, a lot of people travel out of town for help in these regards, but you all are well equipped and have the best technology, just like anybody else, to treat these. How do we get in touch with you?
We'll call our office. We're happy to see new patients, and we'll see them within, most brain tumors we want to see in a couple of days, so we don't miss the diagnosis and get the treatment plan as soon as we can. So we're happy to see anybody with a problem like that.
Awesome. Okay, so pay attention to your body, listen to the signs and symptoms, see your doctor, and trust that we've got some doctors in the house that are well equipped to take care of you here at South Texas Brain and Spine Center. Don't forget to mention Coastal Living sent you.
Coastal Living's Doctor in the House is paid for by South Texas Brain and Spine Center.